Woven in Renfrewshire, at its core, is a project which was designed to pair artists and people working in care. So either paid care staff, like NHS staff, folks working in care homes, but also unpaid carers, and to have artists work alongside and then reflect on or creatively respond to the stories of those care workers.
I think what drew me to applying is that there was a real focus on women's lived experiences, and that's something that I'm quite passionate about. And also women in care-based roles. That was something that it came up a lot in my previous research, like with heritage. There was a lot of undocumented stories of women.
So I encouraged carers to select a box. I had some with me to give them as examples and they could use. And then I encouraged them to think of items that spoke of their experience as a carer, particularly through lockdown. So items that just trigger a memory or mean something good or challenging. So they put a lot of thought into it. And somebody was putting her box together and her husband said to her, you know, this has been amazing. And he said, nobody's ever asked you before what it was like to be a carer. Goodness, every carer should get this.
I was isolating for so long because I felt wrong to be out and about in the world, enjoying the swirl of happiness. Felt so guilty, didn't do enough to save you from the rough health you were in. You'd been suffering for so long. I wanted to make you stronger, live your life longer, to keep on giving the world your amazingness unfurled.
Return from the trench, sitting on this bench, looking at the wildflowers. They have such powers, together with the trees and the hummingbees, that dying COVID members least these flowers feel as yet help us to remember and never forget. I will be marked. So will many others. We coped and carried on.
I'm every carer. Fine line between fine, not fine. I'm every carer. A doctor, a nurse, a healthcare worker. I can't unsee what I saw. I can't undo my mistakes. I can't unfeel what I felt. I can't get back time lost with my family. I can't bring back the dead, whose hands I helplessly held. I can't wipe the panic I felt at not being the hero they applauded.
This project really ended up being about the activity of care. So I thought it was an amazing link with this. The people that the carers I've interviewed come from similar backgrounds. Either they've been a carer all their life or they have come from a family that they've always cared for other people, running events and things like that. Then I got interested in moss. I saw that actually this material has been used for centuries as a wound dressing. So especially sphagnum moss, which holds 20 times its weight when it's dry. Process of handling materials, so more the sensory aspect would be really good for carers that have that kind of change in their life or something going on. So they're not only just caring for, the person, the wife, the husband, but they have their own health needs as well. I've really good feedback from a carer after I explained the moss comforts, and what I was kind of symbolically using them for was to place it somewhere on your body that resonates with the activity of care. And some people have put them on their chest or their stomach, and I was explaining that to her, and she said it's not just one moss comfort I need a whole moss suit.
Based on my experience with carers in Barhead, I built up a relationship with women in care. So I decided that this was a perfect opportunity to really offer them a platform. And I have to say, it was really hard hitting what I learned and what I recorded. Back in July last year, when I started interviewing the carers, the overarching themes that were coming through was this looping sensation, and that was what hooked me. That's what gave me this idea of exploring these motions of physically dressing, undressing, doing bedding, taking bedding off. I wanted to capture that.
The amount of times a day you washed your hands, you're changed in and out of clothes. Even if I had to jump out to the bins, I had to take my full uniform off. So you were donning and doffing every 2 minutes. You were literally PPE on, PPE off, PPE on, because you've got to watch for cross-infection, cross-contamination. How rife the disease was just made nursing homes and hospitals so much more vulnerable.
For Woburn and Renfrewshire, I really wanted to work with domestic staff at the Royal Alexandra Hospital. I've been thinking since lockdown to the present about the way in which the importance of cleaning within our daily lives, the way in which the folks who cleaned before and after us, before and behind us really through lockdown, kind of got us through, how we all learned the importance of what it is to wash our hands, to sanitize our environments. So my process for creating The Writing is on the Wall involved gathering quotes from staff here at the RAH. I would go and have quite short conversations with them, off-the-record conversations where I would ask them about working through the pandemic, working post-pandemic, and about the state of care, their sense of care and care working in Scotland. From all of those conversations that I had over a period of several months, I then transcribed and gathered like a number of the quotes that I felt that kind of resonated or that I had heard examples of again and again. I took those back to staff and asked them to write them out in their own handwriting. Alongside the handwritten quotes from staff, I also wrote up statistics on the state of care and care working in Scotland. Things like, for example, more than half of NHS staff work unpaid additional hours. So the vision for the piece was always to write quotes directly on the wall, things from staff in their own handwriting alongside statistics, and then to have this process of erasure of the piece and those voices and that data as well. So the work itself actually doesn't look like this at all. You know, this is just kind of a moment's documentation of it, but the actual piece was a kind of durational tracing of those voices and those statistics, and then a combined kind of cleaning that work off the wall, cleaning off and making it as though those words were never put on that wall.
People 9 times out of 10 enjoy art, whether it be theatre, whether it be art itself, or whether it be any kind of interaction that way. So if you use this as part of the process, then I think people automatically think this will be fun. So as opposed to looking at a 40-page consultation document, they will sit there and tell you how they feel and how it is, and it'll bring out the best in people. So I think this does artists can make a big contribution to this.
As we are looking at bringing together the bill for the National Care Service, it's so important that is informed by the lived experience of those who are in the front line of caring. And too often there's a lot of unpaid caring that is taking place in communities across Scotland that is not being recognised. The pressures on carers are not well understood, and they're not being adequately supported and rewarded for the work that they do.
It's a fantastic exhibition because what it does is it shows and demonstrates through the use of creative media the life experiences of people who are carers. You know, the struggles they go through, the challenges they face, but the overwhelming love and support that they give to the people cared for. And it's about time we valued them more.